Welcome to the complete migraine deep dive. If you've watched our main migraine breakthrough video, you're ready for comprehensive information covering every aspect of migraines from causes to complete recovery. We'll explore 10 detailed areas with the latest medical research and practical guidance for lasting neurological wellness. Progression and health impact. Without treatment, migraines typically follow a progressive pattern that can significantly impact overall health and quality of life. Initially, symptoms may be occasional mild to moderate headaches occurring monthly, but they often expand to affect cognitive function, work productivity, and family relationships over time. The condition can evolve from episodic migraines occurring fewer than 15 days per month to chronic daily headache that permeates every aspect of daily living and dramatically reduces life satisfaction. The neurological health impact extends far beyond head pain, as migraines trigger widespread brain dysfunction affecting memory, concentration, and emotional regulation. This sustained neurological activation can contribute to increased stroke risk by 40%, depression rates 3 times higher than the general population, and anxiety disorders affecting up to 50% of migraine sufferers. Migraines increase the risk for cardiovascular disease, sleep disorders, and chronic pain conditions, as well as the risk of medication overuse headache, making early intervention crucial for preventing these cascading complications. However, understanding progression also reveals hope for intervention at any stage. Even long-standing chronic migraines respond well to treatment, and the brain's neuroplasticity allows for significant improvement regardless of how long symptoms have persisted. Modern treatments can interrupt the progression and often reverse many of the negative impacts, restoring normal neurological functioning and well-being within 3 to 6 months of beginning appropriate care. Underlying causes and risk factors, migraines result from a complex interplay of genetic, environmental, and lifestyle factors, with no single cause responsible for development. Genetic predisposition plays a significant role, with family history of migraines increasing risk by 50 to 90%, but having genetic risk factors does not guarantee developing the condition. Brain chemistry differences, particularly involving serotonin, dopamine, and CGRP neurotransmitter systems, contribute to increased migraine sensitivity and trigger threshold variations. Environmental factors include weather changes affecting 75% of migraine sufferers, bright lights and fluorescent lighting, strong smells and chemical exposures, and hormonal fluctuations, particularly in women during menstrual cycles, pregnancy, and menopause. People who have experienced head trauma, neck injuries, or concussions are more likely to develop migraines. However, many people with these risk factors never develop migraines, while others with fewer risk factors do, emphasizing the individual nature of the condition. Lifestyle factors encompass irregular sleep patterns and both too little and too much sleep, skipping meals or dramatic blood sugar changes, high stress levels and inadequate stress management, and certain dietary triggers including aged cheeses, processed meats, artificial sweeteners, and alcohol. Physical health conditions including depression, anxiety, fibromyalgia, and autoimmune disorders can also trigger or worsen migraine symptoms. Understanding these multifaceted causes helps eliminate self-blame and emphasizes that migraines are a legitimate neurological condition requiring professional treatment. Diagnosis and assessment. Professional diagnosis involves a comprehensive evaluation that considers symptoms, family history, and functional impairment in daily life. Neurologists and headache specialists use International Headache Society diagnostic criteria and assessment tools to ensure accurate identification and rule out other conditions with similar symptoms. The process typically includes detailed headache diaries, documenting pain patterns, triggers, duration, and impact on work, family, and social activities over several months. Neurological examinations and sometimes brain imaging help rule out secondary headache causes that can mimic migraine symptoms, such as brain tumors, aneurysms, or inflammatory conditions. Many people feel relieved during the diagnostic process because it validates their experiences and provides a clear path forward for treatment. Healthcare providers emphasize the collaborative nature of diagnosis, encouraging patients to openly discuss all symptoms without fear of being dismissed or judged. The diagnostic process also identifies any co-occurring conditions like depression, anxiety, sleep disorders, or medication overuse headache, which affects treatment planning and approach. Modern diagnostic frameworks recognize the complexity of migraine presentations and focus on functional improvement rather than pain intensity alone. This comprehensive approach ensures that treatment addresses all aspects of the condition and maximizes the likelihood of successful recovery. Questions to get the best treatment and outcome. Engaging actively with healthcare providers through thoughtful questions ensures optimal treatment outcomes and builds collaborative therapeutic relationships. Essential questions include asking about different preventive and acute treatment options available, expected timelines for improvement, and specific criteria for measuring treatment success, including reduction in monthly migraine days and improved quality of life measures. Inquire about combination treatments, such as preventive medications plus acute treatments, and whether newer CGRP therapies might be appropriate for your specific situation. Discuss potential side effects of recommended treatments, strategies for managing them, and what to do if initial treatments don't provide sufficient relief after adequate trial periods. Ask about lifestyle modifications that can enhance treatment effectiveness, including sleep hygiene, dietary changes, stress management techniques, and exercise programs tailored for migraine sufferers. Understanding the provider's experience with your specific type of migraine and their approach to treatment planning helps build confidence in the therapeutic process. Important questions also include discussing warning signs that would require immediate medical attention, how to access care during severe migraine episodes, and involving family members or support persons in treatment planning. Ask about long-term prognosis, strategies for preventing chronic migraine development, insurance coverage for newer treatments, and transitioning from acute to preventive care approaches. Request specific success rate percentages for recommended treatments, and ask about clinical trials if standard treatments aren't effective, medications and their effects. Modern migraine medications offer effective symptom relief with improved safety profiles compared to earlier treatments. First-line acute medications like triptans, including sumatriptan and rizatriptan, remain primary treatments for stopping active migraines, typically requiring 30 minutes to 2 hours for full effectiveness while producing fewer side effects than older ergot medications. These medications work by targeting serotonin receptors to reverse the abnormal brain activity and blood vessel changes that occur during migraine attacks. Newer medications show promise for enhanced outcomes with broader mechanisms of action. Next-generation treatments including CGRP receptor antagonists, like ubrogepant and rimegepant, induce rapid pain relief within 1 to 2 hours and are more effective for patients who don't respond to triptans, avoiding the cardiovascular contraindications that previously limited treatment options for many patients. Preventive medications, including CGRP monoclonal antibodies, may be prescribed for patients with frequent migraines, though these require careful monitoring to optimize dosing and prevent treatment resistance. Medication effectiveness varies significantly between individuals, often requiring adjustments in dosage, timing, or switching between different options to find optimal results. Most people experience substantial improvement within 2 to 4 weeks of starting appropriate acute medication and 6 to 12 weeks for preventive treatments. Side effects, when they occur, are typically mild and temporary, including nausea, dizziness, and injection site reactions for preventive treatments that resolve as the body adjusts to treatment or with supportive measures. Holistic and complementary approaches, integrative treatment approaches combining conventional medicine with evidence-based complementary therapies, show enhanced effectiveness for migraine recovery. Recent studies prove that specific lifestyle interventions can reduce migraine frequency by 40 to 60%. Regular aerobic exercise, particularly moderate intensity activities like walking, swimming, or cycling for 30 to 45 minutes 3 to 4 times weekly, produces powerful preventive effects by stabilizing neurotransmitter levels and reducing stress hormones. Stress management techniques provide practical tools for reducing migraine triggers while building long-term resilience. Biofeedback therapy shows significant benefits for many people, particularly when combined with conventional treatments, teaching patients to control physiological responses that can trigger migraines. Dietary modifications, including identifying and avoiding personal food triggers, maintaining regular meal timing, and ensuring adequate hydration, support overall neurological health and may enhance treatment effectiveness. Sleep optimization approaches have proven incredibly effective in providing migraine prevention benefits that people often overlook. These approaches recognize that healing encompasses the whole person, not just symptom reduction. The combination of traditional and complementary treatments often produces better outcomes than either approach alone, offering multiple pathways to recovery and long-term neurological wellness. OTC items that can be of help. Several over-the-counter medications and supplements can provide supportive benefits for migraine management when used alongside professional treatment. Combination analgesics containing acetaminophen, aspirin, and caffeine help reduce mild to moderate migraine pain, particularly beneficial for people experiencing early-stage attacks or those who cannot tolerate prescription medications. Magnesium supplements support neurological function and may reduce migraine frequency when taken regularly at doses of 400 to 600 milligrams daily. Riboflavin vitamin B2 shows promise for migraine prevention through mitochondrial support mechanisms. Research suggests that coenzyme Q10 supplementation plays a direct role in cellular energy production, supporting the use of targeted nutritional interventions for migraine prevention. Feverfew and Butterbur herbal supplements have preventive effects for some people, though these should be discussed with healthcare providers to avoid interactions with prescription medications. Essential oil aromatherapy, including peppermint and lavender, can provide immediate comfort during migraine episodes when applied topically or used in diffusers. These supportive measures work best as part of comprehensive treatment plans rather than standalone solutions. Self-help strategies. Empowering self-help strategies provide immediate tools for managing migraines while building long-term resilience and recovery skills. Ice or heat therapy quickly reduces pain intensity and can be used anywhere migraine symptoms arise. Relaxation techniques help identify and interrupt the stress response patterns that often trigger migraine episodes. Progressive muscle relaxation techniques include systematic tensing and releasing of muscle groups that bring immediate stress relief, and may abort developing migraines when practiced consistently. Creating structured daily routines provides stability and predictability that reduces trigger exposure and helps maintain regular sleep and meal schedules. Regular mindfulness meditation and deep breathing exercises support overall stress resilience and neurological regulation. Gradual return to normal activities helps overcome fear avoidance behaviors that maintain chronic pain patterns and disability. Keeping detailed migraine diaries helps identify personal triggers and successful management strategies for future reference. Building social connections and maintaining meaningful activities prevent isolation and depression while providing natural mood enhancement and stress relief. These strategies complement professional treatment and provide sustainable tools for long-term migraine management. Supporting loved ones. Supporting someone with migraines requires understanding, patience, and knowledge about effective approaches that truly help rather than inadvertently minimizing their experience. Listen without judgment and avoid suggesting that they just need to tough it out, or that it's just a headache, as this diminishes their neurological condition and can increase stress and trigger frequency. Instead, acknowledge their pain and limitations and ask how you can best provide support during migraine episodes and treatment periods. Learn about their specific triggers and warning signs and respect their need for accommodations, including dark, quiet environments during attacks, while encouraging gradual progress rather than pushing them to maintain normal activities during episodes. Offer practical support like helping with household tasks, childcare responsibilities, or transportation to medical appointments. Encourage professional treatment while avoiding becoming their primary medical advisor or trying to diagnose their condition yourself. Maintain your own well-being and set healthy boundaries to prevent caregiver burnout and resentment. Support groups for family members and friends of people with migraines provide valuable resources and connection with others in similar situations. Celebrate small victories and progress, understanding that recovery is often gradual with occasional setbacks rather than linear improvement. Prevention strategies. Building resilience and implementing prevention strategies can significantly reduce migraine risk and prevent episodic migraines from progressing to chronic daily headache. Regular sleep hygiene and consistent sleep schedules create a foundation for neurological stability and trigger avoidance throughout life. Developing healthy stress management skills early helps people navigate life challenges without triggering migraine episodes. Maintaining regular meal schedules and blood sugar stability provides natural buffers against dietary triggers that can precipitate migraine attacks. Learning to identify and address early warning signs before they progress to full migraine episodes prevents the development of chronic pain patterns and medication overuse complications. Regular medical monitoring and preventive care help detect problems early when intervention is most effective. Early intervention during adolescence and young adulthood, when many migraine patterns often establish, can prevent progression to more severe chronic conditions. Education about migraine triggers helps people recognize personal risk factors and modify their environment accordingly. Building strong social support networks enhances stress resilience and reduces inflammatory burden throughout life. These prevention strategies benefit everyone, regardless of family history, by promoting overall neurological wellness and resilience against chronic pain conditions. Subscribe now to join thousands getting reliable health information that improves lives, as knowledge is your best medicine, and we hope you've gained valuable insights from this video series. Make sure to subscribe and like this video. It helps us create even more valuable health tips for you and others. Don't forget to share with anyone who would find this useful. Also, please comment below with any questions or topics you'd like us to cover next. Stay informed, stay healthy,